19 minutes past 7 then, it's Steve with you for the breakfast show today, and let's bring you something ever so slightly more serious. The Health Minister, Matt Hancock, should get an independent panel to look at the plan to reorganise the healthcare setup in Dorset. That's according to the Shadow Health Secretary, Jon Ashworth. He visited Dorset last week, met members of the campaign group Defend Dorset NHS when he was in Poole. Defend Dorset NHS, by the way, determines... This is the CCG, determines healthcare in the county, and they're ploughing on with planned changes which include closing Poole's A&E and maternity unit. It says it's disappointed by these comments from Jon Ashworth and Labour Party continuing to politicise the changes. But during his visit, Mr Ashworth told our political reporter Tristan Pascoe about his worries over these plans.
My big concern is that it feels to me like there hasn't been proper public consultation. There hasn't been a proper analysis about the future health and demographic needs of the area. And look, there's always arguments about the way in which services can be reconfigured, but it feels to me like closing an emergency department and closing a maternity unit at this end of the county will put tremendous pressure down at Bournemouth. And let me put it like this. There's a proposal on Matt Hancock's desk to refer this to the relevant independent panel. Why doesn't he do that? Because if the local health leaders and the CCG think they've got a case, then they shouldn't be worried about it being looked at again. And if the health campaigners here think they have a persuasive case, then if it goes to an independent panel, the arguments will be heard. I just don't understand why the Health Secretary is refusing to make that referral. And I think that would be, given this clearly huge anxiety about this and huge concern in the community as we've been hearing today, that would seem to me the sensible next step.
With Parliament deadlocked as it is, you never know, a general election might be around the corner. So what would you as Health Secretary do if Labour won an election?
Well, we fought the last general election saying that we would halt cuts and closures, and then because we're prepared to put substantially more investment into the National Health Service. Now, I think everybody understands that things never stay the same, things do change, but look, we would put more money into the Health Service, and then we would look again at plans like this. We'd also want to recruit the extra staff. We're short of 100,000 staff in the NHS. We're short of 40,000 nurses, so we'd bring back the training bursary to get the nurses in the NHS that we need. We would halt plans to close services, and these plans would be looked at again. You know, the public pay for the NHS through their taxes. The public have fought for the NHS for generations in this country. The public deserve to be fully involved in decisions about the future of health services in the local area.
Shadow Health Secretary Jon Ashworth there talking to Tristan Pascoe, our Dorset political reporter.